Hello, this is Kim Jong-il. Today's topic is part 1 of decrowding for non-extraction treatment, and space gaining methods will be discussed. Crowding can be mainly divided into horizontal and vertical height displacements. Horizontal displacement describes palatal displacement or rotation of the upper lateral incisors or other anterior or posterior teeth. But today's lecture will focus on the treatment of crowding on the upper and lower canines with vertical height discrepancy. First, the following questions arise. Q1. What is the difference between crowding on the upper and lower anterior teeth? Q. How to resolve crowding. A. Whether to use SWA brackets or Kim's brackets. B. Which wire to use. Q3. How to align teeth. Q4. Which retention appliance to use. First of all, observe whether crowding is on the upper or lower anterior teeth. A shows a class 3 malocclusion pattern. There is no crowding on the lower anterior teeth, and there is on the upper anterior teeth. B shows anterior edge-to-edge bite. Basically, if there is lower anterior crowding, there is a high chance of premolar extraction. And if there is upper anterior crowding, but no lower anterior crowding, it is better to carry out non-extraction treatment. If there is a lower anterior crowding as the photo, the possibility of premolar extraction increases. However, if there is an upper anterior crowding, it should first be classified into class 1, 2, and 3 malocclusions. In class 2 crowding cases, there is a possibility of only upper premolar extraction. However, as the skeletal pattern turns into a class 3, there is a greater possibility of non-extraction treatment. Then bilateral and unilateral crowding should be distinguished. In case of unilateral crowding, space can be gained by strategic leveling. In other words, non-extraction treatment is possible. On the other hand, in case of bilateral crowding, there is an increased possibility of premolar extraction. There are 2 ways to resolve crowding. Superelastic arch wire such as Q-Nitai wire can be used, or space can be created before alignment. Many Caucasians have prominent noses and retruded lips. In this case, superelastic arch wire can be used to align the teeth, because the lips are strong enough to prevent labioversion of the incisors. However, Asians have slightly protrusive profile even if crowding is not severe. Thus, if Asians are treated in the same way as Caucasians, the lips will look even more protrusive. Therefore, crowding cannot easily be resolved by full bonding and superelastic arch wire, and the treatment takes longer than expected. If Nitai arch wire is used on crowded teeth from the beginning, the lateral incisors will be moved labially, and the adjacent teeth may become rotated. However, if open coil spring is used to create space to resolve crowding, rotation of the adjacent teeth can be prevented, and it is easy to maintain the dental arch. Therefore, in case of crowding, many orthodontists use open coil spring to create space. McLaughlin also recommended the use of open coil spring to create space if the lateral incisor is displaced palatally. But in the picture, all the teeth are bonded and loose cinch back is performed. This will cause labial movement of the incisors. This labial movement of the incisors is not a big problem for Caucasians. However, it will cause lip protrusion in Asians, and patients will complain about it. So how is space created? First of all, let's review the effects of open coil spring. Open coil spring can be used to create space for decrowding, upright the meshily angulated teeth, and derotate the meshily rotated teeth. This is how tooth movement when space is created in non-extraction treatment. In case of upper anterior crowding, the use of open coil spring can move only the crown labially, or it can move both the crown and root labially. Which type of tooth movement is desirable? The tooth movement in B is preferable. Let's first discuss the bracket system. Basically, crown labial torque is programmed in the SWA incisor brackets. This means that the crowns of the upper incisors become labially inclined by 15 degrees when MBT appliance is used. There is a high chance of labial movement of the upper incisors if the teeth are fully bonded and loose cinch back is performed. At this time, it should be considered whether it is better to use SWA brackets or 0-degree brackets for the upper incisors. SWA brackets are programmed with +7, 22, or 24 degrees crown labial torque for the upper incisors depending on the manufacturer. Therefore, if preformed arch wire and open coil spring are used with SWA brackets in order to create space, the crowns will be further labially inclined. However, by using 0-degree brackets, labioversion of the crown is minimized while the root moves labially. To sum up, when space is created in non-extraction treatment, the use of 0-degree bracket and Z016 x Z022 SS wire with crown lingual torque on the anterior teeth moves the crown lingually, and the use of open coil spring offsets the crown lingual movement and induce root labial movement. Other words, the crown lingual inclination is minimized. A and B are two different types of brackets, which is the SWA and which is the KIMS bracket. A shows the tooth movement of SWA, and B shows KIMS. In SWA brackets, preformed arch wire with open coil spring is used, and thick rectangular arch wire with 0-degree torque is used in the upper arch for finishing. If a thick arch wire with 0-degree torque is inserted in maxillary brackets with crown labial torque, labioversion is inevitable. KIMS bracket is an SWA bracket with 0-degree torque. Space is created with a thick arch wire with crown lingual torque. And for finishing of Class 3 malocclusion, MIAW with crown lingual torque for the upper arch and crown labial torque for the lower arch is used. In this way, bodily posterior movement of the lower incisors is more possible compared to conventional SWA brackets. If mini-screw is used with SWA bracket, how will the teeth move? The lower incisors are more likely to be lingually inclined. As you can see in the superimposition, tooth movement of the upper and lower incisors is different in KIMS and SWA brackets. This is a Class 3 malocclusion case with upper anterior crowding. If possible, the treatment should induce anterior movement of the A point of maxilla in order to treat with non-extraction approach. After the arch wire is inserted, Weingart utility plier is used for cinch back bend. By bending the distal end of the arch wire inward first and then gingivally, the patient discomfort can be minimized. There are many cases with no lower crowding and palatal displacement of the upper lateral incisors. In this case, the brackets are attached on the upper central incisors, canines, second premolars, and second molars, and open coil springs are used in the lateral incisors areas. How will the teeth move? The incisors move anteriorly and the canines move posteriorly. If the brackets are not attached on the first premolars and the length of the arch wire is maintained by tight cinch back, the canines can move posteriorly while minimizing labioversion of the incisors. Then how is tight cinch back bend performed? First, ligate the arch wire on all the brackets. Perform cinch back bend on one end, and pull the wire on the other side and perform cinch back bend. Check if the arch wire is loose on the other side. Tight cinch back means that since the length of the arch wire is maintained, labioversion of the incisors can be minimized when creating space for the lateral incisors. After the lateral incisors are aligned, open coil springs are used once again but with loose cinch back bend. In order to perform loose cinch back bend, first ligate one central incisor and perform cinch back bend on both ends. When the rest of the teeth are ligated, the arch wire comes loose at both ends. In case of unilateral crowding, improper leveling can result in the rotation of premolars or lateral incisors in the direction of crowding. Mesial rotation of the premolars and distal rotation of the lateral incisors are observed. From the side, the premolars are meshally angulated, and the lateral incisors are distally angulated. In this case, brackets must be strategically bonded. By attaching brackets on the central incisors, lateral incisors, first premolars, and first molars, and using open coil springs in the upper canine areas, the meshally angulated and rotated first premolars can be uprighted and derotated. In this way, leveling can be performed with minimized labioversion of the incisors. If the teeth are fully bonded and superelastic arch wire is used for leveling, the upper canines move palatally, and the adjacent lateral incisors and first premolars move labially, expanding the arch wire. From the side, the upper canines will move occlusally, and the lateral incisors and first premolars will move gingivally. This can result in lateral open bite. When lateral open bite occurs, patients naturally stick their tongue out into the open bite space. During the course of treatment, this type of tooth movement is undesirable. Therefore, by strategic bonding and using open coil spring with knee-T overlay arch wire, the canine can be moved into the arch while maintaining the arch form. In case of crowding, rather than full bonding with superelastic arch wire, I recommend strategic bonding and use of open coil spring. In strategic bonding, especially in case of full class 2 and half class 2 canine key, keep in mind that the brackets are first attached to the upper central incisors, lateral incisors, first premolars, and first molars. Even if crowding is not severe, instead of attaching brackets to the central incisors, lateral incisors, canines, and first premolars, bond the central incisors, lateral incisors, first premolars, and first molars, and use open coil springs in the canine areas in order to facilitate the establishment of Class 1 canine and premolar keys. This patient has no lower crowding but severe crowding on the upper right quadrant. There is a slight crowding on teeth 22 and 23, but leeway space of the second deciduous molar can be utilized. On the right side, there is a severe crowding on teeth 13 and 15. In strategic leveling, it is better to align tooth 13 first and then tooth 16. But as in the photo, the eruption of tooth 13 can be delayed. In this case, it is better to derotate tooth 16 first. In order to derotate tooth 16 first, open coil springs are used in teeth 13 and 15 areas, as well as teeth 23 and 25 areas on the left quadrant. The use of open coil springs in 4 areas increases the risk of labioversion of the incisors. So it is advisable to use ERO 16's X022 SS arch wire with crown lingual torque on the anterior teeth. After tooth 13 erupts, teeth 13, 15, 23, and 25 are bonded and re-leveled. So when is it appropriate to use 016 x 022 SS arch wire with anterior crown lingual torque? It should be used in order to prevent proclination of the upper and lower incisors. Derotate the mesial rotation of the first and second molars early in the treatment. And when open coil springs are used in 3-4 areas. Turret is used to apply -7 degrees anterior torque on ERO 16 x 022 SS arch wire. As -7 degrees torque is naturally applied to the posterior part of the arch wire, there is no need for additional wire bending. To sum up, for non-extraction treatment of cases with crowding, use 0-degree brackets for the upper incisors. And create space by strategic bonding and appropriate use of open coil spring. Sometimes there are cases that require re-diagnosis in the middle of non-extraction treatment. It is usually a good idea to decide on re-diagnosis before 6 months of treatment, rather than attempting to create enough space. Because if the patient's profile becomes unesthetic or incisor overjet increases before 6 months of treatment, it means that the upper incisors are severely proclined. At this time, if it is continued to open up space, the buccal overjet may be severe in the first premolar area, resulting in a scissors bite pattern. In this case, there is a high possibility of premolar extraction. Because the treatment duration significantly increases if 1 or 1.5 year has already passed before re-diagnosis and it is decided to extract premolars, it is advisable to decide on re-diagnosis before 6 months of treatment by evaluating aesthetics and overjet. These are the methods of minimizing labioversion of the incisors in non-extraction crowding cases. 1. Attach 018 slot standard edgewise brackets on the upper incisors. 2. Use 016 x 022 stainless steel arch wire with -7 degrees anterior crown lingual torque to resolve anterior crowding. 3. Use open coil springs in areas with erupting teeth or crowding. 4. Use tight cinch back and loose cinch back appropriately to create space. What results can be acquired? By using open coil spring on the arch wire with crown lingual torque, space can be gained while the current upper and lower incisor positions are maintained. The tooth movement pattern is such that both the crowns and roots move labially. In other words, if current profile and the upper and lower incisor positions are acceptable, non-extraction treatment is possible even if there is crowding. If the teeth are fully bonded with SWA brackets, open coil spring is used. Treatment begins on both the upper and lower arches, and occlusion is tight. What will happen? There is a greater likelihood of labioversion of the incisors. In other words, it will be unesthetic and increases the possibility of extraction. This is a patient with severe upper and lower anterior crowding. Both the upper and lower canines are lingually inclined. If the lower inner canine width is forcibly increased, the post-treatment stability decreases. If the teeth are fully bonded, the upper and lower inner canine widths increase, and the lower incisors become more labially inclined. This is called active enlargement of the lower intercanine width. On the other hand, if the upper arch is aligned first, the upper intercanine width is enlarged with normal canine inclination, and the lower arch can be naturally enlarged. This is called passive enlargement. Therefore, if there is insufficient buccal overjet between the upper and lower canines, it is necessary to enlarge the upper intercanine width. In order to minimize labioversion of the incisors in non-extraction treatment, strategic bonding rather than full bonding, standard bracket rather than SWA bracket on the upper incisors, and open coil spring should be used appropriately. In addition, instead of beginning treatment on both the upper and lower arches, it is better to begin treatment of the upper arch first. If the occlusion is tight, occlusal force should be removed. So far, we discussed space-gaining methods for non-extraction crowding case and appropriate use of open coil spring. Details of tooth alignment will be discussed in Part 2. Thank you for watching.